it doesn't matter if you smile. Okay, it doesn't matter if you smile or not, but really what matters is, are you providing the right care to the patients or
Yeah.
not?
Yeah, one of the things that I've heard a lot of times, and I'm sure you've heard it too, is like the DSOs are so bad because they take advantage. The DSOs are like these businesses that take advantage of the doctors who take advantage of the patients, right? And they do all this unnecessary treatment and those kind of things. And obviously, I'm sure that's happened before, right? But it's also happened at single practices before too. But with your technology, I think it kind of removes some of that, right? Like you can now look at it and say, no, we're actually treating all the things that we're supposed to be treating. Is that do DSOs roll up that information to be able to look at it universally? Like we're doing the normal standard treatment that we're supposed to be doing on these patients?
Yeah, and most DSO leaders that we interact with, I think, when DSO started, I think, like any new, even in any new technology, like you have different use cases that develop, and then people figure out how to use it in the best possible way. Similarly, in when the DSO business model came about, of course, like there was less oversight and all that stuff that happened, which resulted in a lot of misuse as well, or overutilization, etc. Here, at least for now, and you probably are as familiar with the industry, I think a lot has changed.
Mm-hmm.
The shows, it's not
It's not the
will
wild,
this
wild west
even
anymore.
happen? Exactly. So it's and here they have their compliance teams, they have their auditors.
Yeah.
Even they're making sure that the right treatments are happening, and they want to do the right thing.
Yeah.
Now the question is, can you really do the right thing when if you're not measuring clinical performance?
Mm.
And that's the real question to be answered here, and that's what Overjet technology helps you do, is really to measure clinical performance. And once you can, then you can actually do the right thing. And here it is about, like, okay, are the right treatments being done in my practices? Are the right protocols being followed in my practices? Protocols we've set for our teams and what we've trained them on, are those being followed, etc. as well? So there is a lot of and we do know, like, the DSOs are here to support these practices, and that's what their goal is. They're dental support organizations,
Yeah.
and they feel that this is a way for them to support their practices as well, and of course ensure a standard of care, a minimum standard of care that
Yeah,
exists, and then
that's the word I was looking for. Minimum standard of care. Because let's be honest, I know I feel the same way you do about DSOs. There's probably 80-90% of them are great. There's the outliers that maybe aren't so great, but that's the same is true for individual practices. But if you go online and you read the comments about DSOs from the solo practitioners, it's not great about DSOs, right? There's a lot of negativity. And what I'm wondering is with Overjet, with that minimal clinical benchmark that you're setting, I feel like that's going to bring more clinicians into the idea that, hey, this is good. They are doing what they're supposed to be doing. Does that make sense?
Yeah, no, I think that makes sense. And for any kind of business to really scale, right? Like, say if you owned a Starbucks, right? And you wanted to own another Starbucks, and and make this into I don't even know how many Starbucks there are, like
Thousands,
thousands of
yeah.
Starbucks.
Yep.
If you wanted to do that, you would need standard operating procedures. You would need
Yes.
every Starbucks to operate to at least a certain level, etc.
Yeah.
And then there might be some people who are great with the customers, and others might be okay. But you would say, okay, this is the minimum bar that we need to make sure everything happens. And the way they can do it is, like, gather that information, like take surveys, like figure out like what's really happening. And I would say this is a tool like that, where it allows you to collect that information. But actually, in a practice, it doesn't matter if you smile. Okay, it doesn't matter if you smile or not, but really what matters is, are you providing the right care to the patients or
Yeah.
not? And you have no way of knowing, because surveys don't tell you this. Because if you read, for example, Yelp reviews on practices or Google reviews, what you'll see is, okay, the patient, it's like how they were treated in the front office, or if they got like a lip balm or not,
Yeah.
or stuff like that they actually address in those reviews. But they're not educated enough about oral health to say
Yeah.
what was the right treatment recommended, or what was the
Yeah.
quality of the restoration. Did it have an open margin, for example?
Yeah.
And that's where the technology can really come in and provide a way to benchmark clinical performance or practices to help improve practices,
That's
right? Like
awesome.
even if you're, yeah, if you're running a business, like just knowing what's happening is better than not knowing.